One more time, thank you so much for having me today. I'm Alex. I'm founder of Autismify, and we are building a care ops platform for behavioral therapy. And we do not just manage another data manager. We leverage an AI to create tools that really empower therapists so they can focus on what matters most, on providing compassionate care. And today, we all see the incredible growth of in autism and other diagnoses and conditions, but the other side of the coin is that there is a shortage of mental health professionals worldwide. In every country, demand for therapists keep climbing, but supply is not catching up, and we see these dynamics, especially in autism care in the United States. Behavioral analysts, BCBAs, are in very short supply these days. Many of them have doubled caseloads. Burnout is widespread across the field, and last year, employees turnover hit 100% in uh, certain organizations, and that is severe crisis in care. But it is not just a crisis in the field. Right now, thousands of families wait months for care, and thousands of children miss their important developmental moments. And the real pain behind this problem is that the significant amount of time, up to 80 hours each month, are lost to paperwork and admin tasks. And this creates a brutal 60 to 40 split of billable and non-billable hours among practitioners, and it forces constant overtime work and just to keep up. And ultimately, it undermines trust. Uh, trust trust that BCBAs have in their field and in their employers because they feel overworked and unsupported very often. And today, we have a real chance to change that with and not by replacing therapists with AI. No, we don't want to do that. This momentum of advancing LLMs combined with the critical shortage of professionals creates a unique opportunity. It's time to equip healthcare professionals. It's time to equip therapists with the tools that help them. It's time and way beyond that, just a simple EHRs or note takers. Now we can create smart therapist or and client-centered solutions designed to align and empower uh, all clinical roles, not only BCBAs. And I think of it like an Iron Man suit, but for behavioral therapists. And we are a special team designed to build that. We have deep expertise across tech, healthcare, and autism support. I myself bring 15 years of building and scaling digital products used by millions. My co-founder and COO, Dmitry, is medical doctor and healthcare professional who worked over a decade in healthcare marketing and consultant. And we have a third co-founder, Joe. He's the founder of largest autism-focused NGO in Portugal, Vencer Autismo. And together, we're building the tool that empowers clinicians and transform how behavioral therapy works. And so, how do we tackle this situation? How we turn this vision into reality? And we started narrow. We started by automating work in one single but crucial process. We started with parent trainings. By handling the prep work and content creation here in a single process, we help to claim up to 20 hours per clinician each month. And that unlocks up to $3,000 in lost revenue per therapist for clinics. It is a win-win situation for everyone. And we take the unnecessary burden off, and so clinicians can focus on what matters most, providing care, providing direct services. And that is not just a concept. or presentation or bold idea, our product is live. We're using AI, and just with a few clicks, a clinician can generate a comprehensive, tailored parent training plan based on their clinical documentation and clinical decisions. We do not we are not decision makers. Our platform is not decision maker. We rely 100% of clinical decision and provide clinicians with tailored content. And moreover, they can share this content with the family and engage family between parent training sessions. And now it takes only 10 minutes, not an hour or hour and a half anymore. And we support the full cycle of parent training, from the initial design through delivery, family engagement to outcome measurement. It's not only time efficient, it creates comprehensive picture on child's development, combining every perspective in one view. Parent's perspective, clinical perspective, RBT's perspective. And we achieve that very fast. Our approach is to move quickly. We started in February last year. By June 2025, we already had MVP-ready prototype and launched first demos with clinics. And by the end of last year, we are already piloting our product with clinicians in the United States, bringing clinicians and families on board. We move fast. We know the field, and now we're looking for partners to move even faster. We have already proven that this solution works with private practitioners or individual therapists. We know we can help them. And now it's time to scale. Now we're looking for bigger players, visionaries in visionary corporate partners or visionary therapy providers. And together, I think we can transform Autismify into an enterprise-grade platform that scales efficiency across the entire clinical team. And we're also looking for academic partners, research institutions, and labs to help us validate our methods and explore AI in clinical settings across different countries. So my request is that let's scale care together, because no family should have to wait for support. Thank you so much.
Could you repeat that, because I don't think I'm loud enough? Do you have any LOIs for the US, for US customers?
So for US customers, we have a legal entity in the United States, so we can work with US customers, and we comply all the regulations in the US, so we can work with US customers. We're HIPAA compliant, and we are ready to scale. And moreover, we do work with US customers right now.
Okay. Any other questions for Alex? All right. Thank you, Alex.
Thank you so much.